Each of the following is true regarding spore tests except for one. Which one is the exception? Spore tests are used in order to test the efficacy of sterilization, which is the highest form of decontamination in the dental clinic. This is used to kill bacteria, viruses, and bacterial spores on critical instruments that may breach mucous membranes in the oral cavity and pose a high risk of transmission of blood-borne diseases. Sterilization is also tested through mechanical and chemical means, making D our correct answer, as we do need other methods of monitoring because there are many different points at which the sterilizer can fail to perform properly. So mechanical monitoring includes checking that the sterilizer has been running at the proper pressure, temperature, and exposure time and should be performed during every load. Chemical monitoring is also done at every load, specifically inside every package, to ensure that the sterilizing agent has been able to reach the chemicals inside and can be checked with indicator strips that will change color if it has worked. So let's take a look at our incorrect answers. A is incorrect. It reads that a spore test should be used on each sterilizer at least weekly, and this is the expected frequency, so this answer is incorrect. We do want to conduct a spore test weekly rather than monthly or at even longer intervals because it'll just help us reduce the risk of exposure to patients and the use of improperly sterilized instruments for if some reason the sterilizer was not working properly and we failed to catch it. Option B reads that a spore test should be used for every load with an implantable device, and this answer is incorrect as this is something that should be done. Remember, we're looking for the exception. So this needs to be done because implantable devices will remain in the body and pose a high risk of infection if improperly sterilized. So prior to implantation, we need to make sure that they test negative for any spores or microbes. Option C reads, spore tests are the most accepted means of monitoring sterilization because they assess the sterilization process directly by killing known highly resistant microorganisms. And this is also incorrect as it is a true statement, and remember we're looking for the exception. With spore tests, we use a highly heat-resistant bacteria. If it is able to be killed in the process, then we know that more common microbes that are less heat-resistant will also be effectively killed during sterilization. The bacteria that we commonly use is spores from Geobacillus xerothermophilus.
Question 33 reads, shortly into the extraction procedure, generalized stiffening of the extremities is noted as well as cyanosis of the lips. Rhythmic jerking of the limbs follow. Each of the following is an appropriate course of treatment for this patient except one, which is the exception. Our patient has a history of seizures. Also, from what's described in the question, we can tell this is a seizure. Grand mal seizures, which are also known as tonic-clonic seizures, are a generalized type of seizure that causes loss of consciousness, as well as violent tonic and chronic muscle contractions. So this question is asking us what is not appropriate for a treatment option for this patient who is experiencing a seizure. Option A reads, maintain an open airway and monitor vital signs. This is very important during a seizure because you want to make sure that they don't have any trouble breathing or choking, and if there are any changes to their vital signs, to notify emergency medical services. So this would be incorrect. Option B reads, remove all sharp objects away from the patient. While they're having a seizure, you want to make sure that they don't injure themselves, so this would be incorrect. Option C reads, turn the patient into a left lateral position. So when a patient is having a seizure, it's best to just place them in a comfortable position, specifically a supine position, so that they can protect themselves from hurting themselves or falling. Turning them to a left lateral position is best because it'll help prevent choking. So this is incorrect. Leaving us with option D, give IV diazepam immediately. We would give intravenous diazepam or midazolam and then call emergency services if the seizure doesn't stop within 5 minutes. Most seizures usually stop within 5 minutes and resolve on their own, but diazepam is used for those seizures that don't, and it's used to stop cluster seizures. If your patient doesn't have a history of seizures, you would need to call emergency services. It's also important to know that if your patient has had a seizure, that you check if they're reoriented and responding after their episode. Also, the patient should not be allowed to drive home. So this would be the correct answer for this question.
What is the peak absorption range for the most commonly used photoinitiator in dental resins? Photoinitiators are used in dental composite resins to polymerize the monomers and strengthen the material for use as a restoration. So we do have different types of dental resins. There is a light cure, a self-cure, and a dual cure. So light cure resins commonly use the photoinitiator camphor-chlorine in order to initiate the polymerization reaction. And this photoinitiator needs to be activated by irradiation in the form of UV or visible light. Self-cure resins rely on benzoyl peroxide as an initiator and can be cured without irradiation. However, they do have a limited working time of around 2 minutes before they set. Dual cure resins are able to be self-cured or light cured, so this means that they contain both camphor-chlorine and benzoyl peroxide. So the most commonly used composite resin in dental filling is light cured dental resins, and as we can see here, it requires UV or visible light in order to initiate the polymerization. So what this question is really asking us is which range of wavelengths is required in order to cure light cured dental resins. So if you take a look at option A, it reads 355 to 381 nanometers. But if we think of the light that we use to cure composite resins, we know that this light is blue, and we see here that the blue light falls within this range of around 400 to 500. And we also know that camphor-chlorine is activated at 468 nanometers. So if we take a look at the options, we can see that A is well below this range that we are looking for, so it's incorrect. So like I said, we're looking for 468 nanometers, which is in that blue light spectrum. If we take a look at the answer B, this is also incorrect because it reads 381 to 455 nanometers. D is also incorrect as it reads 481 to 555 nanometers, and this is above the ideal range that we're looking for. And this leaves us with our correct answer, which is C, and it reads 455 to 481 nanometers, and we can see here that this range of blue light matches up with answer C, and the activation of camphor-chlorine, which requires 468 nanometers, also falls within this range.
So question 22 reads, each of the following is a statement on the frequency of denture replacement by the American College of Orthodontics except one, which is the exception. So the American College of Orthodontics developed a position statement on how often to replace dentures. It's important to replace a denture when we see signs of damage or the patient is uncomfortable. It gives dentists an outline to be able to recognize when to replace a denture. So option A reads, development of chronic irritation on the oral mucosa beneath a denture base. Development of chronic irritation on the oral mucosa beneath the denture needs evaluation and possibly replacement, because it can lead to things like epulis fissuratum, oral ulcers, or candidiasis. This is part of the position statement on denture replacement by the American College of Prosthodontics, so because of that, this would make this an incorrect answer. Option C reads, changes in teeth supporting a removable partial denture or overdenture. So if there are changes in the teeth that support an overdenture and RPD, there needs to be correction so you can make an accurate prosthesis for the patient. It is one of the conditions that's outlined by the American College of Prosthodontics on denture replacement, so because of that, this would be incorrect. Option D reads, inability or reluctance of the patient to wear the removable prosthesis. A patient not wanting to wear a removable prosthesis is an immediate red flag for the dentist, and it requires the dentist to further evaluate and decide if there is a need for replacement of the existing denture. Again, this is a position statement on denture replacement by the American College of Prosthodontics, so this would be incorrect, and it leaves us with option B. More than 10 years have elapsed since the denture was fabricated. The American College of Prosthodontics states that if it has been more than 5 years since the denture has been made and it has signs of damage, it's time to replace it. Waiting for 10 years to get new dentures is not a condition that was outlined by the position statement of the American College of Prosthodontics. So, because of this false statement, this would make it the correct answer for this question. So question 93 reads, which precaution is necessary when prescribing metronidazole for a patient? So metronidazole is an antibiotic that's used to treat anaerobic bacterial infections, protozoa infections, and common microaerophilic bacterial infections. In dentistry, we use it for mouth infections like infected gums or oral abscesses. This question is asking what precaution is necessary when taking or prescribing metronidazole. So option B reads, avoid acetaminophen. So there is no interaction between metronidazole and acetaminophen, so this is incorrect. Option C reads, avoid smoking. Some studies show that smoking makes metronidazole less effective, but there hasn't been enough evidence to prove that it's dangerous or causes a negative interaction, so this is incorrect. Option D reads, avoid metformin. Metformin is an anti-diabetic medication for type 2 diabetics. There's no interaction with metronidazole, so this is incorrect. Leaving us with option A, avoid alcohol use. So drinking alcohol while taking metronidazole can cause something called disulfiram-like reaction, or alcohol intolerance. So this happens when a disulfiram-like drug causes an adverse reaction to alcohol that can lead to nausea, vomiting, flushing, dizziness, throbbing headache, chest and abdominal discomfort, and general hangover-like symptoms. Some cases even lead to death. This is because there's an accumulation of acetaldehyde, which is a toxic metabolite of alcohol that's formed by the alcohol dehydrogenase enzyme. To avoid this reaction, it's suggested that a patient not drink alcohol during their metronidazole treatment and for 3 days after finishing their metronidazole treatment. So this is the correct answer for this question. Question 21 reads, each of the following is the correct statement regarding cardiac implanted devices except one. Which is the exception? So implanted cardiovascular devices are very common nowadays. They use electrical impulses to help make sure that the patient's cardiac rhythm stays normal. In dentistry, we use several electronics that may cause electromagnetic interferences. So it's important to know which ones they are. These include ultrasonic scalers, electrosurgery instruments, apex locators, osseointegration tools, and electrical pulp testers. E-cigarettes and wearable smart devices also disturb implanted cardiovascular devices. So option A reads, latest cardiac devices are better shielded and less prone to interference. Newer models are sealed in metal castings and have special filters and rejection circuits that help limit electromagnetic interferences. So this is true, and it makes it incorrect. Option B reads, electrosurgery devices pose the greatest risk of electromagnetic interference. There have been in vitro studies to prove this, so it's a true statement and it makes it incorrect. Option C reads, proper use and distance help in minimizing interference risk. So dental electronic devices that come within 37.5 centimeters or 15 inches of the cardiovascular implantable electronic device can cause an increased risk of electromagnetic interference. So keeping a proper distance will minimize the risk and makes this a true statement and thus incorrect. Leaving us with option D. Magnetostrictive ultrasonic scalers are safer than piezoelectric ones. In vitro and in vivo studies have actually shown that magnetostrictive ultrasonic scalers are more likely to produce electromagnetic interference. So that makes them less safe than piezoelectric ultrasonic scalers, and thus the correct answer for this question.
How much supplemental fluoride is appropriate to prescribe for this patient? Fluoride is used to remineralize enamel and therefore reduce decay. Water fluoridation at a community level has had enormous impacts on reducing incidence of cavities. However, there still are some communities that do not have publicly fluoridated water sources, so supplemental fluoride is recommended in some cases. Taking a look at the patient box, we can see that the patient is a 4-year-old male who is experiencing early childhood caries, or ECC, which is defined as the child having one or more cavitated, missing, or filled surface in any primary tooth. Importantly, the patient lives in a non-fluoridated community, so treatment will change depending on the fluoridation status of their water sources. So although fluoride can occur naturally in water, generally levels that are lower than 0.6 parts per million are considered non-fluoridated water sources. Fluoridated water sources have either 0.7 parts per million or higher, and this is when the fluoride is able to help remineralize enamel and reduce caries risk. So taking a look at the answers, we first have A, which reads 0, and this answer is incorrect as the patient does have caries and is living in a non-fluoridated community. So as a provider, we want to provide a fluoride source for the patient, and this would be in the form of a fluoride supplement. Someone who would not need any fluoride supplements are those that are living and drinking from water sources that have fluoride levels above 0.7 parts per million. Option B reads 0.25 milligrams, and this answer is incorrect. As we can see here, there are guidelines on how much fluoride supplementation is needed based off of the child's age and the level of fluoridation in the drinking water. And here we can see that the patient is 4 years old and there is no fluoride in the water. So if we were to give the patient 0.25 milligrams in fluoride supplements, this would be insufficient. Option D reads 0.75 milligrams, and once again, if we refer to this chart, it seems as if 0.75 milligrams would be too much. This means our correct answer is C, which reads 0.5 milligrams. And taking a look at the chart, we can see that based off of the patient's age and water fluoridation, the patient should be taking 0.5 milligrams a day in fluoride supplements in order to reduce the risk of decay. Which is shown in association with increased fluoride retention? This is an important question as we may find patients who are in these environments or practicing these actions, so helping them understand the risks and benefits of fluoride use in these circumstances is crucial for their oral and systemic health. Option A reads high saltwater exposure, and this answer is incorrect. Although fluoride is naturally found in the water, the level of fluoride found in the ocean water is around 1.2 to 1.4 parts per million. And while this level is higher than that of fluoridated water sources, which is 0.7 parts per million, 1.2 does fall in the upper range of acceptable levels of fluoride. However, just because there is high fluoridation in salt water, high exposure to this does not necessarily mean that fluoride is retained more easily. Option C reads consuming dairy products, and this answer is also incorrect. Dairy products do not contain high amounts of fluoride. However, some do have anti-carcinogenic effects due to the casein, as well as high concentrations of calcium and phosphate. The calcium and phosphate are essential in promoting the remineralization of enamel, making it more resistant to decay. However, the calcium also does impede on the body's ability to absorb fluoride as it binds to the fluoride and traps it. So this answer is incorrect, as dairy products would actually lower the fluoride that is retained in the body. Option D reads increased physical activity, and this answer is incorrect, as increased physical activity does not increase the fluoride retention. This means that our correct answer is option B, which reads higher altitude. Because water will reach a boil at a lower temperature and evaporate more quickly, this means that there tends to be a higher fluoride concentration in the water. Consumption of things that require water, especially tea, coffee, or other foods, can increase the amount of fluoride that is in the body. In addition, the body can become dehydrated more quickly in higher altitudes, so it is recommended that people who live in these areas consume more water compared to those who live in lower altitudes. Not only is it the consumption of fluoride that increases the population's exposure to fluoride, it is also the frequent use of coal for heating homes and cooking in higher altitudes that may increase fluoride exposure. While not a common risk for those who live in lower altitudes, fluoride is a concern for those who live in high altitude regions due to the high consumption of fluoride. However, fluorosis is generally only an issue in young children who still have undeveloped teeth. As their teeth are developing and excess fluoride is introduced into the body, this may lead to interactions between fluoride and the hard tissues of the teeth, affecting the mineralization process. In mild cases, it can lead to white spots that represent hypomineralized area, or in more severe cases, brown pigmentation or mottled areas that can become an aesthetic concern.
So question 90 reads, which is the most appropriate treatment? Here our female patient is complaining of random shocking shooting pain on her right side at times. She has pain that happens when you touch the right side of her face or when she's brushing her teeth or chewing. There are no significant factors on her x-ray and all of her teeth are within normal limits. So this could only lead us to trigeminal neuralgia. We see these signs and symptoms in most commonly women over the age of 50, just like our patient, who have trigeminal neuralgia. In this condition, it usually affects one side of the face. Patients experience and complain of very similar pain when they're eating, drinking, talking, or even if something as simple as wind blows on their face. So option B reads acetaminophen. So this is an over-the-counter analgesic and we use it for mild to moderate dental pain or when the patient is contraindicated for non-steroidal anti-inflammatory drugs, but it will not help with trigeminal neuralgia, so this is incorrect. Option C reads hydrocodone. So hydrocodone is an opioid that we use to treat pain, but it doesn't help with trigeminal neuralgia, so this is incorrect. Option D reads carbapenems. So this is a beta-lactam antibiotic that acts on aerobic and anaerobic gram-positive and gram-negative organisms, but this is not a bacterial infection, so this would not treat trigeminal neuralgia, making this incorrect, leaving us with option A, carbamazepine. This is an anticonvulsant and it inhibits the neuron or sodium channel activity, so it brings down the excitability of neurons, and this will then treat the trigeminal neuralgia, making this the correct answer for this question. So question 10 reads, during the extraction, an emergency involving the patient occurs in which cardiopulmonary resuscitation is indicated. What is the correct depth of chest compressions? So if a patient is experiencing cardiac arrest, you need to do cardiopulmonary resuscitations, which is CPR, and then call for emergency medical services. So the American Heart Association released guidelines that stated for adult CPR, you need to have 30:2 chest compressions to breath ratio, so 30 chest compressions and then 2 breaths, with a single or 2 or more rescuers, so 1 person or 2 or more people helping. And the depth of the compression should be 2 inches, which is 5 centimeters. And then you should let the chest recoil or come back to its position after every compression. So option A reads 5 inches. We just stated that the guideline states 2 inches or 5 centimeters, so this is incorrect. Option C reads 3.5 inches, and again we said 2 inches or 5 centimeters, so this is incorrect. Option D reads 1.5 inches, and again this is incorrect for adults. However, 1.5 inches is the correct depth for young children and infants. But again, we're looking for the depth of an adult, which is 2 inches or 5 centimeters, so this is incorrect. Leaving us with option B, 2 inches, and that correctly aligns with the American Heart Association guideline of a compression depth of 2 inches or 5 centimeters, making option B the correct answer for this question.
Each of the following is a general recommendation for the prevention of caries and gingivitis except for one. Which one is the exception? The ADA does recognize that oral home care is extremely important in overall health of patients, so they have created 3 categories that should be discussed with patients during hygiene appointments. So this includes general recommendations, lifestyle considerations, and personalized recommendations. So option B reads clean between teeth daily, and this answer is incorrect as this is something that is suggested under general recommendations. The ADA recommends that patients brush twice a day for at least 2 minutes in order to mechanically remove food debris and plaque buildup. This action will help with the prevention of caries and periodontal diseases. And the recommended length of time is 2 minutes, which has been shown to have more of a significant reduction of plaque compared to a 1-minute brushing duration. Option C reads brush teeth twice a day with a fluoride toothpaste, and this answer is incorrect as this is still something that is recommended for the general population. So brushing twice a day compared to just once or even less has been proven to reduce the incidences of gingival recession, tooth decay, and periodontitis. Using a fluoridated toothpaste will prevent risk of decay and help remineralize enamel. Option D reads eat a healthy diet that limits sugary beverages and snacks, and this answer is also incorrect as this is a recommendation that falls under the general category. Advising patients on reducing sugary beverages will help limit the exposure to carbohydrates that can reduce pH levels in the oral cavity and contribute to dental decay. It may also be beneficial to discuss with patients that snacking on meals and emphasizing that frequency of snacking will prevent the pH of the oral cavity from returning back to normal, keeping teeth in a state that is more prone to decay. Option A reads use a power toothbrush, and this is our correct answer as it is not a general recommendation. The use of a power toothbrush is something that can be recommended to individuals that are having issues with motivation or manual dexterity. It has been shown that proper use of technique with just a manual toothbrush is just as effective as use of a powered one. So patients may also prefer to just use manual toothbrushes versus powered ones, in which case demonstration of an ideal technique is necessary to ensure that patients are able to reach all areas of the oral cavity.
Question 23 reads, each of the following is an important patient management protocol to be followed in this case except one. Which is the exception? So here we have a patient. His chief complaint is, I'm missing a front tooth and want an implant. His background and or patient history is that he has acute hepatitis B and is allergic to penicillin. So before going into our options, we have to understand that our patient has acute hepatitis B, which is a challenge for a dentist. This infection is still in its active stage, so it requires specific dental management. The patient is restricted to urgent care only, and elective procedures shouldn't be performed. So option A reads obtaining thorough medical history. This is required because the patient is suffering from acute hepatitis B, so this would be incorrect. Option B reads consulting the patient's physician to establish a safe treatment plan. So considering the patient has acute hepatitis B, you know this affects the liver. You want to refer to the patient's physician for a proper medical examination so that you can have clearance to continue with dental treatment. So this would be incorrect. Option C reads following standard precautions while dealing with the patient. It's important to follow standard precautions to prevent things like cross-infection. This includes wearing PPE and using work practice and engineer controls to eliminate the incidence of contracting hepatitis B. So this would be incorrect. Option D reads carrying out oral prophylaxis before placing the implant. So oral prophylaxis is used to clean the mouth of plaque and calculus. But if a patient has a disease and it's in its infectious stage, it should never be done. This is just going to spread the infection to other patients and to staff. So this is a false statement and it makes it the correct answer for this question. So question 16 reads, which organism is the most resistant to steam autoclaving sterilization? So steam autoclaving is a very popular way to sterilize instruments in a dental clinic. How it works is that the moist heat that's created in the autoclave kills microorganisms by denaturing the proteins and enzymes. So when an enzyme or protein becomes denatured, that means its normal shape is deformed because some of the hydrogen bonds are broken. Usually the autoclave is set to 250 degrees Fahrenheit or 121 degrees Celsius for 15 to 20 minutes at 15 psi. This is going to allow for greater penetration, a shorter cycle, and ability to sterilize a variety of instruments. Other methods run the risk of possibly corroding some instruments. Option A reads Listeria monocytogenes. This is a mesophyll, which is an organism that thrives in 20 to 45 degrees Celsius temperatures. This organism would not survive the 121 degrees Celsius autoclave temperatures, so this would be incorrect. Option C reads Staphylococcus aureus. So this is another mesophyll organism, meaning it also thrives in 20 to 45 degrees Celsius temperature. So it would not survive in the very high temperature that the autoclave has, and it would easily die, making this incorrect. Option D reads Escherichia coli or E. coli. This is another mesophyll and shares the same characteristics as the other organisms that we just mentioned, so this would be incorrect. Leaving us with option B, Bacillus thermophilus. So this is a thermophilic aerobic spore-forming bacterium. This bacteria is often found in soil and hot springs, and it thrives in temperatures as high as 41 to 121.1 degrees Celsius temperatures. Again, it's described as a thermophil because of this bacterium's ability to thrive in high temperatures, and it's only inactivated when exposed to a temperature of 121.1 degrees Celsius for at least 20 minutes. So that means it can be used as a biological indicator to test sterilization effectiveness, making this the correct answer for this question.
Question 21 states, each of the following is correct regarding managing amalgam waste except one, which is the exception. So here we're going to go through some do's and don'ts with regards to managing amalgam waste. So what are some good things to do? Use chairside traps. It's a good way to physically trap any amalgam through suction. Regularly inspect and clean traps. Use amalgam separators. This is one way to filter out amalgam. Use appropriate waste services to recycle and or dispose of collected amalgam. What are some things not to do? Don't use bulk mercury. It can be easy to have high amounts of mercury or have mercury spillages that could be dangerous. Don't rinse devices containing amalgam over drains or sinks. Here it could be an issue having mercury in the water supply, so it's important not to have it over the sinks or drains. Finally, don't put used amalgam capsules in biohazard containers. And the reason for this is because amalgam capsules can be recycled. So as we've discussed here, option choices A, B, and D are incorrect. And C here is correct because it is the exception here. Don't recycle used disposable amalgam capsules is not great advice because these amalgam capsules can be recycled. So C is our answer here.
What bacterial species is used as an indicator for autoclave sterilization? So autoclave sterilization is typically used for critical instruments, which are those that can penetrate oral mucosa and have a high risk of transmitting bloodborne diseases. Their purpose is to kill not only all viruses and bacteria, but also bacterial spores. So this is the highest method of decontamination that is used. With autoclave sterilization, there are three methods that are used to detect whether sterilization was effective or not, and these are mechanical, chemical, and biological indicators. And of course, this question is asking about which bacterial species is used, so we're looking at biological indicators. And this is known as the spore test, and this will monitor sterilization efficacy. So this test needs to be performed weekly in order to ensure that only properly sterilized instruments are making their way to use in the dental operatory. The biological indicator is typically a bacterial endospore that is highly resistant to heat and is used to measure the microbial killing power of the autoclave. We want it to be heat resistant because we know that if the autoclave is capable of killing this indicator, then it will be capable of killing our common bloodborne bacteria and viruses. So given that, D is our correct answer, and it reads Geobacillus xerothermophilus. And this is a species that is used as an indicator. The name gives us a little bit of a hint that it is heat resistant. In fact, they can withstand heat of up to 121 degrees Celsius for 12 minutes. This means that answers A, B, and C are incorrect because these bacteria are not heat resistant, and we know that in order to be used as a biological indicator, they need to be able to withstand high temperatures. So these three species here cannot be used as biological indicators for autoclave sterilization.
Question 54 reads, which is the most appropriate drug for IV sedation? So option A is lidocaine. This is an amide anesthetic that is used as a local anesthetic or as a topical anesthetic ointment, but not IV, so this would be incorrect. Option B reads fentanyl. We know this is a narcotic analgesic that can be used with other medications and for IV sedation, but it's not the main drug that we use for IV sedation, so this would be incorrect. Option C reads bupivacaine. This is another amide anesthetic that's used in dentistry as a local anesthesia, but it's not an IV sedation, so this is incorrect. Leaving us with option D, midazolam. This is a water-soluble benzodiazepine drug that facilitates the binding of GABA, which is an inhibitory neurotransmitter, at various GABA receptor sites in the CNS. It causes anxiolysis, sedation, amnesia, and anticonvulsant effects. It's metabolized in the liver, and if used with certain drugs such as erythromycin or azole antifungals, it can block the enzyme and cause high levels of midazolam in the plasma, which can be toxic. This drug is used for oral and IV sedation, so this would be the correct answer for this question. Question 5 reads, each of the following is an appropriate management strategy when treating an anxious patient except one. Which is the exception? So here we're looking for management strategies that are not helpful when you're treating someone who is anxious. Option A reads showing empathy. This is a great tool in treating someone who is anxious because this way it allows you to understand your patient better, communicate with them appropriately, and also acknowledge their feelings. So because this is an appropriate management strategy, this would be incorrect. Option C reads informing the patient regarding the procedure and the possibility of pain. So when you do this, this will create trust between you and your patient because you're being honest. This is going to help reduce their anxiety because this way they'll be able to trust you in this procedure and in future procedures. So this would be incorrect. Option D reads, explain to the patient she can raise her hand to take a break. So this will give your patient a level of control throughout the procedure, which will help relieve her anxiety, and it helps prevent consequences on your patient being in a stressful or painful situation for too long. So this is incorrect. Leaving us with option B, calming the patient by telling her not to worry. So this is actually going to cause false encouragement because you're not giving clear and specific information. You need to be honest and give your patient more information so you can help them have a clear and realistic expectation for the procedure. So because this is false, this would be the correct answer for this question. Question 99 reads, lingual varicosities are most commonly associated with what condition? So lingual varicosities are also known as caviar tongue, and a varicosity is a condition that indicates an enlarged vein, artery, or lymph vessel. So in the mouth, they're seen just like this image. They're purple, red, and under the tongue or on the floor of the mouth, where the mucosal surface is thin and translucent. So option B reads hypertension. This is not true, so this is incorrect. Option C reads xerostomia, which is also not true, so this is incorrect. And option D reads diabetes, and this is also not commonly associated with lingual varicosities, so this is incorrect, which leaves us with option A, advanced age. So this is true that lingual varicosities are commonly seen in older patients. This is because as you get older, there is a breakdown of the elastic fiber in the venous wall connective tissue. So this is the correct answer for this question.
Each of the following is an adverse effect of cigarette smoking, except for one. Which one is the exception? Over 36.5 million adults in the United States currently smoke cigarettes, and there are more that participate in other forms of tobacco use, so it is important to understand the effects of cigarette smoking and tobacco on oral health. Products that contain tobacco have been associated with both immediate and long-term effects that can be isolated to the oral cavity as well as systemic. So if we take a look at our answers, A reads adverse effects on gingival health, and this answer is incorrect as this is something that can occur with the use of cigarettes. Not only can it lead to gingival recession, it is one of the biggest contributors to periodontal disease, as smoking does promote plaque accumulation. Despite the negative effects on gingival health, smoking will actually reduce the inflammatory response of the gingiva due to constriction of capillaries and blood vessels, meaning that even if a patient does present with gingivitis, they may not have an increased bleeding response. So this is something to look out for. Option C reads enamel discoloration, and this answer is also incorrect as this can occur with cigarette smoking and is fairly prevalent. People who smoke will present with heavily stained teeth, usually yellow or brown in staining, and this occurs due to both the nicotine and tar that is found in cigarettes. In addition, smoking will increase the likelihood of plaque accumulation, and the staining molecules can more easily adhere to plaque, so this can contribute to the appearance of staining. However, the enamel discoloration and staining of plaque are both types of extrinsic discoloration, and this can be removed easily with a professional cleaning. Option D reads oral cancer, and this answer is incorrect as this is a risk of cigarette smoking as well as tobacco use. Patients that are habitual smokers are at around 5 to 10 times more likely to get oral cancer. Option B reads teeth misalignment, and this is our correct answer as this is not something that is an adverse effect of cigarette smoking. However, tooth loss is something that may occur as a consequence of cigarette smoking. In addition to the adverse effects of cigarette smoking that we have already discussed, it can also cause mucosal lesions to arise, and this includes things such as nicotine stomatitis and oral leukoplakias. It can also cause impaired healing and xerostomia, which can lead to further issues with caries and periodontal disease. There are also some serious systemic effects such as cataract development, pneumonia, cancers such as pharynx, larynx, esophageal, stomach, pancreas, cervix, kidney, and bladder cancers, chronic bronchitis and emphysema, and cardiovascular diseases. And the number of adverse effects on health means that as healthcare professionals, every attempt should be made to promote smoking cessation. The U.S. Department of Health and Human Services have suggested that the following questions be asked, and these are more commonly known as the 5 A's. The first A is ask, and to ask the patient any questions that may identify any forms of tobacco use. Second is to advise, so to urge them to quit. Third is to assess if they're able to quit at this time. 4 is to assist, so if they are motivated, we can provide counseling or pharmacotherapy. And the 5th A is to arrange or schedule a follow-up either in person or over the phone to ensure that they remain motivated.
Question 92 reads, what is the ASA classification of this patient? Here we have a 56-year-old male patient. His chief complaint is, my lower tooth hurts so bad. His background and patient history is that he's a smoker, he's hypertensive, and he has a history of a stroke 8 weeks ago. His current findings are blood pressure of 131/76, irreversible pulpitis, and symptomatic apical periodontitis of the lower left first premolar. So option A reads ASA 1, and this classification is for completely healthy patients who do not smoke or drink little to no alcohol. However, our patient has hypertension, history of a stroke, and he's a smoker, so this would be incorrect. Option B reads ASA2. So this classification is for patients with a mild systemic disease that doesn't cause any functional limitations. So that could include controlled diabetes and hypertension, obesity, and mild lung disease. This also includes pregnancy, smoking, and social drinking. But this patient has had a stroke, so this is incorrect. Option C reads ASA3. So this classification is for patients with a severe systemic disease that causes functional limitations, and that would include poorly controlled diabetes, hypertension, chronic obstructive pulmonary disease, morbid obesity, hepatitis, alcohol abuse, end-stage renal disease but with regularly scheduled dialysis, and a history of MI or a stroke over 3 months ago. However, our patient had a stroke only 8 weeks ago, which is about 2 months, so this would be incorrect, leaving us with option D, ASA4. So this classification is for patients with severe systemic diseases that are a constant threat to life, and that includes ongoing cardiac ischemia or severe valve dysfunction, sepsis, DIC, end-stage renal disease, but not undergoing regularly scheduled dialysis, and a stroke less than 3 months ago. So our patient had a stroke 8 weeks ago, which is about 2 months, which falls under the less than 3 months ago, making this the correct classification and the correct answer for this question.
This question asks which of the active ingredients that is commonly found in mouth rinses has a whitening function. So A reads fluoride, and this is an active ingredient that has the ability to reduce tooth decay through promoting the remineralization of enamel, but it does not have a whitening function, making this answer incorrect. It's usually found in the form of sodium fluoride, and with this ingredient, it's important to remember that it takes around 30 minutes in order for the fluoride to work, so rinsing with water after is not necessary and should be avoided for at least 30 minutes. Option B reads essential oils, and this answer is also incorrect as they do not have a whitening function. Essential oils are found in over-the-counter therapeutic mouth rinses in order to reduce plaque-induced gingivitis, and it can do so as it does have some antiseptic properties. Option C reads cetylpyridinium chloride, and this answer is also incorrect as it does not have a whitening function. This ingredient is added to therapeutic mouth rinses and can reduce bacteria that cause bad breath, but it can also reduce gingivitis as well. However, we have to remember that this may cause tooth staining if used for longer periods of time, so it is important to warn our patients about this. Option D reads peroxide, and this is our correct answer as this is the ingredient that is able to whiten teeth. Hydrogen peroxide and carbamine peroxides can be found in mouthwashes, and the molecules will penetrate through enamel and dentin in order to reduce the pigmentation found in these layers. However, peroxides can only treat certain stains, such as those that are more topical, like coffee or smoking stains. They will not work on reducing tetracycline or fluoride stains. Peroxide is also added to mouth rinses as they can reduce irritation caused by gingivitis and soothe mouth ulcers. But with peroxide mouth rinses, excess use or using concentrations that are too high can cause irritation and redness, so it is important to be aware of this side effect.
Question 29 reads, during the administration of local anesthesia, the patient starts to sweat and develop convulsive movements. Soon after the patient loses consciousness, what is the most likely cause of the patient's current condition? So option A reads hypoglycemia. This is low blood sugar. Our patient does have diabetes, and this is a common thing seen in diabetics when they miss meals while still taking diabetic medication like insulin, or if they've taken too much medication. Considering the patient's HbA1c level that is normal and the timing of the symptoms, we know this is incorrect. Option B reads epinephrine reaction. So what this is an increase in epinephrine levels or adrenaline levels in the body because of too much being administered. So this could happen if you inject local anesthesia with epinephrine into an artery. The reaction usually goes away within 5 to 10 minutes because of rapid metabolism of the drug. This is not what our patient is experiencing, so this is incorrect. Option D reads epilepsy. So this is a CNS disorder where the brain activity becomes abnormal and it causes seizures or periods of unusual behavior, sensation, or lack of awareness. If the epileptic episode lasts more than 5 minutes, it's a medical emergency called status epilepticus. So emergency medical services should be activated. But this is not the case, so this is incorrect. And it leaves us with option C, syncope. So our patient is sweating, developing convulsive movements, and then suddenly losing consciousness. Also, our patient has type 2 diabetes and is also anxious. A patient who has diabetes can suffer a lot of different side effects if their blood sugar levels are not under control. However, our patient's levels are under control because their HbA1c is 6.4%, which is normal for diabetic patients. But the anxiety that the patient might have when giving them anesthesia with a needle may have caused them to faint out of fear, which is the most common clinical emergency, syncope. So all these factors make this the correct answer for this question. And remember, if you have a patient faint in the office, the best position is to put them in a supine position with their legs elevated and their head tilted back, just like this image. So question 19 reads, what is the physiologic intraoral pH level? So what is the intraoral pH level? The pH scale is used to express the acidity or alkalinity of a solution. If the pH is lower than 7, that means it's acidic. And if it's higher than 7, that means it's alkaline. The intraoral pH is within the range of 6.7 and 7.4. So this is a number that you'd want to remember. This is when the intraoral environment is stable and healthy, and there's little incidence of decay and little to no calculus. So looking at our options, option A reads 5 to 5.5. This is an acidic environment and will cause demineralization of the enamel. If teeth remain exposed to this acidic pH for a long time, there's a risk for developing caries. So this is incorrect. Option C reads 7.5 to 8. This is incorrect because it's above the physiological level. It can help in remineralization, however, it's not the physiological level that we are being asked about, so this is incorrect. Next is option D, which reads 4.5 to 5.5. So again, this is too low, and fluorapatite demineralization happens when the pH levels are below 4.5. So this is incorrect. And it leaves us with option B, 6.7 to 7.4. This is within the physiological range, so this would be the correct answer for this question. So question 101 reads, what is the most appropriate next step? So here we have an 8-year-old male patient. His chief complaint is the parent says, my son is here for a cleaning. The background and patient history includes asthma, and his current findings include itchy sores at corner of the mouth, clear fluid oozing from sores. We're also given this image. So based on this image and the current findings, which tell us that the sores are itchy and there's fluid oozing from them, we assume that this patient has impetigo. So impetigo is a bacterial infection that's caused by Staphylococcus aureus or Streptococcus pyogenes bacteria. It's seen on the face, legs, arms, and it's common in young children just like this patient. So children get this through daycare, contact sports, mosquito bites, or poor hygiene. So this question is asking, how would you move forward with this patient? So option B reads, clean face with soap and water prior to and after treatment. So this might be helpful with minimizing the transmission of the infection. It doesn't guarantee it, and you will be putting yourself and your staff and possibly other patients at risk. So this is incorrect. Option C reads, continue with no modifications. So again, this is going to put other people at risk of contracting this infection, so this would be incorrect. So placing a rubber dam just isolates the tooth. However, it does not reduce the risk of spreading the infection to other people, including yourself. So this is incorrect. And that leaves us with option A, resume treatment once the condition has resolved. Impetigo is contagious and it can spread to other patients, your staff, and again, yourself. So it's best to just pause and wait for the condition to be treated so that you can continue with your dental treatment. Also, dental procedures can be painful for patients who have impetigo. So this is the correct answer for this question.
Each is a method for improving dental unit water quality except for one. Which one is the exception? It's important to maintain the dental unit water quality at a certain level, which is below 500 colony forming units per milliliters, and this is in order to prevent the spread of diseases through these water lines. Taking a look at option A, we can tell that this is our correct answer, as warming up dental unit water would not improve dental unit water quality. Generally, providing a heated environment will only serve to allow bacteria to reproduce, and it'll actually encourage biofilm formation. While this generally would not be an issue for healthy patients, those that are immunocompromised or very young or very old may be more susceptible to diseases if dental units have a water quality that is not safe for patients. So let's take a look at the other options to see how they can improve dental unit water quality. So B reads filtration, and this is a method that is commonly used in order to improve the water line quality. These will only help to trap bacteria that are already present in water and can do so with low levels of germicides such as iodine or silver. However, it will not eliminate and control biofilm that's in the water, but it will help to improve water quality. C reads chemical treatments, and these are also a common method to control bacterial growth and improve dental unit water quality. There are two types of chemical treatments. We can have periodic chemical treatments and continuous chemical treatments. With the periodic treatments, we first purge the water lines and then add the treatment to the reservoir. After that, we fill up the water lines, and once that's done for the recommended period of time, the water lines must be flushed in order to remove the chemical. On the other hand, there are also continuous chemical treatments, and these are continuously released into the reservoir to filter the water. Finally, we have D, which reads anti-retraction valves. What this does is it prevents used water from returning into the handpiece, and this is helpful because it reduces the risk of transmission of any bacteria that may be found in the used water. Other methods that can be used to increase the quality of dental unit water lines can be to use a self-contained water system, essentially meaning that it's not connected to the building's plumbing, and what this will do is it'll allow dentists to provide a water source that is known to be clean, such as sterile water, so this ensures that there are few colony-forming units and a low risk of infection from these water lines.
Question 97 reads, at least how many chest compressions should be performed per minute during CPR? So CPR is cardiopulmonary resuscitation, and we do this when the heart stops beating to keep blood flowing. We do this in emergency cases, and as a clinician, it is important that you know how to do it. Option A reads 60, so 60 is not true, so this is incorrect. Option B reads 80, which is also not true, so this is incorrect. And option D reads 120, which again is not true, so this is incorrect. And that leaves us with option C, 100. So in CPR, chest compressions are given at a rate of 100 to 120 per minute, and it needs to be at a depth of 2 inches for an adult. Rescue breaths are also given, and it's 2 breaths after every 30 compressions. So this is the correct answer for this question. Question 8 reads, each of the following is a health problem that untreated sleep apnea can contribute to except for one. Which is the exception? So, sleep apnea is a serious sleep disorder where there is recurrent, complete, and partial upper airway obstructive events during sleep. Basically, a patient's breathing repeatedly stops and starts during their sleep. This can lead to intermittent hypoxemia and sleep fragmentation, and can actually contribute to cardiovascular disorders such as hypertension, heart failure, coronary artery disease, pulmonary hypertension, atrial fibrillation, and stroke. So looking at our options, we are looking for something that sleep apnea would not contribute to. So option A is hypertension. This is a cardiovascular disorder that sleep apnea does contribute to. According to the American Heart Association, sleep apnea affects 30% to 50% of people who have hypertension and up to 80% of people who have resistant hypertension. So this would be incorrect. Option B would be stroke. Again, it's a cardiovascular disorder that sleep apnea contributes to. American Heart Association states that untreated sleep apnea is a risk factor for stroke and stroke recurrence, mortality, and functional and cognitive outcomes. So this would be incorrect. Option C reads heart failure. Heart failure is another condition that untreated sleep apnea contributes to. Heart failure patients with sleep apnea actually have an increased risk of adverse outcomes, including heart failure-related symptom progression, hospitalization, and mortality. So this would be incorrect, leaving us with option D, hyperthyroidism. So hyperthyroidism is a common cause of sleep dysfunction because of hyperkinetic muscular activity. However, it's not a condition that untreated sleep apnea contributes to. So this would make it the correct answer for this question. So question 22 reads, each of the following are expected oral findings in patients who smoke except one, which is the exception. So smoking tobacco has several effects in the oral cavity, including halitosis, hairy tongue leukoplakia, nicotinic dermatitis, periodontal disease, smokeless tobacco, keratosis, smoker's melanosis, and squamous cell carcinoma. Patients present with periodontal disease, however, there is no gingival inflammation and bleeding. The proposed mechanism is that nicotine causes vasoconstriction. However, this isn't confirmed. Looking at our options, we want to find the least expected finding in a smoker. Option A reads gingival recession. So like we said before, periodontal disease is included as an oral manifestation, so this would be incorrect. Option B reads xerostomia. It is believed that nicotine reduces salivary flow, so that would lead to xerostomia, making this incorrect. Option D reads impaired healing. Smoking distorts the immune system, which leads to a delay in healing, making this incorrect, leaving us with option B, increased bleeding on probe. Again, like we said before, there is a decrease in bleeding and gingival inflammation in smokers, so this would be the correct answer. So question number 6 asks us, the most appropriate next step would be to. So for this question, it's asking us what our plan of treatment would be after assessing what is given to us in the patient box. So this patient is a 78-year-old male. His complaint is my denture is loose and it hurts to wear it. His upper and lower dentures were delivered 2 weeks ago, and he also suffers from hyperlipidemia and hypertension. He takes simvastatin and amlodipine. In his findings, we see he has a blood pressure of 110 over 77 and that he has excess tissue present in the upper right buccal vestibule. So based on what is given, we can conclude that this patient is suffering from epulis fissuratum, which is an inflammatory fibrous hyperplasia seen in patients with an ill-fitting denture. It's commonly seen in the buccal vestibule. This fits with the criteria given to us about this patient. So now looking at our options, option A says we retake impressions and fabricate a new denture. Taking a new impression and creating a completely new denture is an unnecessary and lengthy step when it comes to this particular case and would make option A incorrect. Option B states, soak the denture in an antifungal solution. So since this is not showing signs of a fungal infection, using antifungal solution would not treat this case, and therefore it's incorrect. So option D states, place implants in both arches and fabricate an overdenture. Considering the complaint and current findings of the patient, placing implants and fabricating an overdenture would not treat the case of an ill-fitting denture and is therefore incorrect. So this leaves us with option C, which reads, reduce the overextended denture borders. So by doing that, we can fix the fitting of the denture and thus remove the source of irritation. And this will allow the epulis to heal on its own. So that makes option C correct.
Which treatment modifications are needed, if any? So let's start off by taking a look at the patient box, and we can see that the patient is a 28-year-old male who's in need of a filling. We can see in his history that he has been diagnosed with HIV and he is taking 2 medications for this. So HIV is a bloodborne disease, and some common modes of transmission are through sexual contact, vertical transmission from mother to child during birth, breastfeeding, needle stick injuries, or percutaneous injuries. And the only 2 we really have to worry about in dentistry are the last 2. So what this means is that HIV isn't really transmitted through saliva or aerosol generating procedures, which means that an isolation room is not needed. These isolation rooms are designed in order to contain airborne pathogens and prevent the transmission of patient to provider, and this typically is used if the patient has an active TB infection and has an urgent concern or an emergency. So A, which is isolation room, is incorrect, as we do not need to use this for this patient who has HIV. Option C reads disposable instruments, and this answer is also incorrect, as we do not need to use disposable instruments for HIV-positive patients. All dental instruments that are categorized as critical, so those that can penetrate into soft tissue or bone, these should be sterilized, and this is because there is a high risk of transmitting infections. However, sterilization will eliminate all pathogenic microorganisms, including bacterial spores, so this is enough to reduce the transmission of HIV. We don't need disposable instruments. Other dental instruments that are semi-critical, so for example, mouth mirrors, dental trays, and condensers, these have a lower risk of transmission. They are still sterilized, and these are both part of the standard precaution, so we do not need to use disposable instruments for this patient, making C incorrect. Option D reads high-level disinfectants only, and this answer is incorrect, as a disinfectant should be used only for those items that pose the least risk of transmission. So, for example, in non-critical patient care items, and this involves tools that only come into contact with intact skin, such as blood pressure cuffs or the radiographic head. And this is because disinfectants will kill viruses and bacteria on surfaces, but it does not destroy all microbial forms. For example, it does not kill bacterial spores, while sterilization does. So this is why we can't use high-level disinfectants only when treating this patient with HIV, or any patient for that matter. This leaves us with option B as our correct answer, as we don't need any treatment modifications for this patient. Instead, we just need to follow standard precautions. And what this entails is following the proper IPAC procedures. We also discussed before that we need to sterilize all critical and semi-critical items, and disinfectants can only be used for non-critical items. It is also important to note that patients who have been diagnosed with HIV and are currently taking medications and have been shown to have an undetectable viral loads will not pose a risk of transmission, which is why we do not need any additional precautions. However, there are some cases in which we do need to make treatment modifications and take additional precautions, and these are likely when patients have an infection that is likely to be transmitted through large respiratory droplets. what is the length of time a practice should keep dental records after a patient's last visit? So in this question here, we are talking about what is known as record retention, which is, like the question states, how long a practice needs to keep a patient's dental records after the last visit. In some states, this time may vary depending on whether the patient is a minor or an adult. In fact, the length of time in general will depend on the state and federal laws, so this makes B the correct answer. In general, the ADA recommends that the state recommended length of time that should be considered as a minimum requirement and that dentists should aim to keep all records for at least 10 years following the last visit. This recommendation is different for minors, where the ADA recommends that records should be maintained for at least 5 years instead of the 10. There are also guidelines related to destroying these records when it is time, so dentists may want to consider consulting with a lawyer just to ensure that the process is followed and also to make sure that the patient's privacy is protected and HIPAA is not breached. If we take a look at the options, D is incorrect, as we should aim to keep dental records well past the completion of treatment, as knowing the patient's dental history may play a role in treatment planning in the future. Option C is forever, and this is also incorrect, as we do not need to keep a patient's dental records forever. Many dental offices would not do this due to the lack of physical space for charts or study models. However, they are obligated to keep them according to the state and federal laws, so however long they state that they need to have them for. Option A is 6 years, and while this might be the case for some states, this does not apply to all states, as each has its own law surrounding the length of record retention. So once again, it is important to ensure that you know the laws in the state that you are practicing in surrounding record retention as well as record destruction.
Question 38 reads, before performing any dental treatment, the patient in the dental chair starts wheezing on expiration and coughing. What is the next step? So this patient has asthma. We see this in their patient box, meaning this is a chronic inflammatory disease in the airways. So patients who have asthma have episodes of acute airway obstruction and airway reactivity to different stimuluses. So this patient is having an episode because they're wheezing, coughing. So this patient is currently having an episode because they're wheezing and they're coughing. Other symptoms would be shortness of breath and chest tightness. And this question is asking what you should do next. So option A reads provide supplemental oxygen. This is not the first thing that you need to do when a patient is having an asthma attack. There are other steps you need to take, so this is incorrect. Option C reads call 911. So this is also not the first thing that you need to do when a patient is having an asthma attack. There are other steps that come before this, so this is incorrect. Option D reads administer rescue medication. Again, this is not the very first thing that you need to do, so this is incorrect. Leaving us with option B, assume a comfortable position. So this is absolutely the first thing that you need to do if a patient is having an asthma attack. You need to stop the dental procedure that you're doing and allow the patient to be in a comfortable position. After that, then you need to keep the airway open and monitor their oxygen saturation. Then you need to provide supplemental oxygen through a nasal cannula or a mask, and then you can administer a rescue inhaler. Then you can continue monitoring and call 911 if there's no improvement. So this is the correct answer for this question. Question 41 asks us, a visually impaired older adult patient visits a dental office for getting a submerged root piece removed. What is a good dental office strategy to help such patients? So here our patient is older and has vision problems. So what can we do as dentists to help communicate or further explain the procedure to our patient? Option A reads, opening all windows allow sunlight to bathe the clinic. If you open all the windows in the clinic, it actually causes too much glaring or harsh light, which could be uncomfortable, especially for a visually impaired patient. So this is incorrect. Option B reads, using the same color on door handles and stair markers. If you use the same for different areas in the clinic, it would make it difficult for a visually impaired patient to tell the difference. Instead, you'd want to use different or contrasting colors to make it easier. So this would be incorrect. Option D reads, using prescription bottles without any print. If a prescription bottle has no print, there will be no labels or instructions, and that can be very dangerous. A prescription bottle with no print should never be dispensed to any kind of patient, so this is incorrect. Leaving us with option C, using large print demonstrations and written materials. A patient who is visually impaired has trouble seeing things, so using large font sizes makes reading written materials a lot easier. So all demonstrations, signs, and written materials should be in a large font size. So this would be the correct answer.
Placing dental sealants in an adolescent having deep pits and fissures but no caries on the occlusal surfaces of permanent molars falls under what level of prevention? The most important way to reduce the incidence of oral disease is to prevent it before it starts. And so the ADA does have several recommendations for preventive methods and different gradings for each method. There are 3 levels of prevention. First, we have the primary level, and this aims to modify patients' behavior so that conditions will not develop. With the secondary level of prevention, the disease is already present, but we aim to prevent it from reoccurring or prevent it from progressing further in severity. In the tertiary level, there is already progression of the disease, but the point of this level is to restore any function that might have been lost and to improve the quality of life. So just based off of this alone, we can tell that option C is incorrect, as preventive level is not a valid level of prevention. Moving on to our other options, option B reads secondary level, and we know that in this level there is already the presence of a disease. But based off of our prompt, we know that there are no caries, which means that there's currently no active disease in this patient. So this means that option B is incorrect, as we are not yet treating the disease, preventing recurrence, or preventing progression. Instead, an example of this type of prevention would be to place sealants on incipient caries in order to prevent it from progressing into active decay and cavitation. Option D reads tertiary level, and this answer is also incorrect, as once again, we know that the patient does not yet have caries. An example of a tertiary level procedure would be to make dentures, crowns, and bridges in order to replace edentulous areas that have occurred due to disease. This means that our correct answer is A, which reads primary level. The placement of sealants on a tooth that has no signs of disease is considered primary prevention. And other types of primary level of prevention are oral health education, prophylaxis, fluoride use, and these will help
So for question 4, it states, each of the following is required of employers according to the Occupational Safety and Health Administration, or OSHA, except one, which is the exception. So for this question, it helps to have an understanding of the employer's responsibilities concerning PPE. Now looking at A, it states, employers must assess risk from hazards in the workplace. This statement is true and not the exception because employers do have a responsibility to be aware of the risks in the workspace that they are working in and are providing for their employees to work in. And it's important that these risks are communicated effectively to employees to ensure that they are safe. So this is not the exception, and we can move on. Looking at statement B, it states, employers must provide appropriate personal protective equipment or PPE for their employees. This statement is also true, and the reason for this is because employees within the context of dentistry are going to be working with biohazardous materials and potentially bloodborne pathogens. Now, as a result, they need to be protected from these things, and PPE is one way to ensure that they are kept safe. So employees do need to ensure that they are provided this from their employers. Looking at statement D, it states, employers must clean provided PPE to ensure functional and protective efficacy. Now again, because individuals working in this dental workspace setting are going to be encountering bloodborne pathogens and biohazardous materials, it's important that their PPE is in functional and protective shape and capacity. And so in order for this to happen, it's important that employers are effectively cleaning any PPE that is provided by them. So this statement is also true and not the exception, and we can move on. Looking at statement C, it states, if employees choose to use their own PPE, the employers are then not responsible for maintenance of such PPE. Now, this statement is false. It is the exception here. And the reason for that is because employers do have a responsibility to ensure that any PPE, whether it is provided by them or by the employees, is correctly maintained and cleaned. And this is especially in the case of individuals or employees providing their own PPE. So here we are with C as the correct answer choice for this question.
What percentage of individuals with tongue piercings exhibit tooth damage? Oral piercings are common in the adolescent population, and the most common site for piercings are the tongue. Due to the extensive list of negative health consequences of tongue piercings, the ADA does highly recommend against getting these. Not only does the actual piercing come with complications, the process of placing the piercing is highly prone to causing infections and can even lead to life-threatening infections such as Ludwig's angina. One of the consequences is tooth damage, and this happens quite often in patients with tongue piercings. So our correct answer here is B, which is 26%. Option A is incorrect, as tooth damage occurs more frequently than 16%. Options C and D are incorrect, as tooth damage does not occur this frequently in individuals with tongue piercings. Each of the following is a desired feature of an ideal mouthguard according to the ADA except for one. Which one is the exception? The ADA does have recommendations for an ideal mouthguard, and they are as follows. They need to be properly fitted and adapted to oral structures. They have to be made out of a resilient material that's approved by the FDA, and it has to cover all teeth in one arch. It has to be able to stay in place comfortably and securely. It does have to be physiologically compatible with the wearer, easy to clean, and also have a high impact energy absorption. So let's take a look at our options. Option A reads have an accurate fit and adaptability with the mouth and oral structures. We can see it here down on the list, and this means that it is something that the ADA recommends. Having a mouthguard that is fitted is so that it can be comfortable to the wearer and effectively provide protection against traumatic forces to the dental arch. And having a comfortable mouthguard is also essential in ensuring that the patient does wear it during contact sports and gets that full protection. Option C reads, be made of resilient material covering all remaining teeth in one arch. And as we can see, it is also here in the list. And this is another characteristic of an ideal mouthguard according to the ADA. Typically, mouthguards are made to cover the maxillary arch in most cases, and some materials that are used are ethylene vinyl acetate, polyolefin, and polystyrene polyolefin copolymers, or thermoplastic copolymers such as EVA. And these materials are resilient and able to absorb the energy from high impact forces. Option D reads have a high impact energy absorption to reduce the intensity of transmitted forces, and this answer is also incorrect as
Question 32 states, bisphenol A or BPA may be found in each of the following dental materials except one. Which is the exception? A. Dental sealants. So dental sealants involve polymerization, and as such there's a risk of BPA release. Therefore, A can be crossed off the list. Next we're looking at C, composite resins. Composite resins also involve polymerization, and so with polymerization comes a risk of BPA release. We can also cross this off the list. Finally, we're looking at D, denture acrylic. Now, denture acrylic is a plastic and it is subject to changes over time, and as such, monomer release may contain BPA. So we can cross D off the list as well here. Now we're looking at dental implants as our solution, but we need to understand what aspects are involved when we're looking at dental implants. For example, when we're looking at the root analog, this is comprised usually of titanium, and because we're not looking at resins and polymerization here, there's no risk of BPA release. Now you might be wondering, when we're looking at dental implants, what about the crowns? What are those made out of? Well, it can be comprised of many different materials. It can be created from zirconia, which is a ceramic. It can be created from lithium disilicate, which is a glass ceramic. It can be created from porcelain fused to metal, or it can also be created from gold. But in all of these instances, we're still not looking at resins and polymerization. Therefore, there's no risk of BPA release, and B is our correct answer choice here.